You're watching Coping with COVID-19 with Chris Manners. Today's special guest is Dr. Andrea Tenner.
Hi, I'm Chris Manners, and you're watching Coping with COVID-19. Today my guest is Dr. Andrea Tenner. She's the Operations Section Chief at San Francisco's COVID Command Center that's located in the Moscone Convention Center. That's where she is today, and she's with us to talk about the city's new high-volume vaccination sites and San Francisco's vaccination efforts. Dr. Tenner, welcome to the show.
Hi, thanks, Chris. It's good to be here with you.
Let's start by talking about the high-volume vaccination centers and the new Mission Neighborhood Center. How many of these centers are we setting up, and where are they located? And how many people are they going to be able to vaccinate?
So we're setting up 3 high-volume sites that are in partnership with major health systems in our communities. So we tried to locate them in some of our highest prevalence neighborhoods that are easiest to access. So we have one that's located here at the Moscone Center that's in the South of Market area. Another one is at City College of San Francisco, which is in the Ocean View, Merced Heights, and Ingleside neighborhood. And then the third one that is coming down the pipe is our produce market that's in Bayview. So as far as the number of people we can vaccinate, we are hoping that once we have adequate vaccine supply, we'll have the capacity to vaccinate over 10,000 San Franciscans a day, combined across San Francisco. As I'm sure you have heard in the news and other settings, vaccine supply has been a big challenge. But our goal is to try to make sure that we have the infrastructure in place so that when vaccine's available, that we can get it into arms as quickly as possible. We also, though, have some other sites in addition to the large volume sites. So the Mission Neighborhood site, for example, was set up in an effort to expand neighborhood vaccine access across the Bayview, as well as Excelsior, Visitation Valley, and other neighborhoods with the highest infection rates for COVID-19. And those that have limited access to healthcare services. So that site, when our vaccine capacity increases, may be able to expand to have about 200 to 400 vaccinations a day. And then we also have, through the Department of Public Health, we have a network of community clinics and neighborhoods across the city that are providing vaccines. So we're trying to give people as many options in whatever way is comfortable for them to be able to get vaccine when our supply increases. So we're trying to have a menu of options available so that we can get people vaccinated as quickly as possible.
I think the City College location has a lot of potential capacity as well, right?
Yes, the City College site could do 3,000 plus. Right now it's quite limited by vaccine supply, but yes, it's got the capacity to do quite a few patients.
Well, that brings me to my next question. Where are we getting the vaccines from, and who's providing them to the state and to the city?
Yeah, that's a really good question. So the vaccines are distributed by the federal government, who procures the vaccine, and then it goes to each of the states. The states then distribute the vaccine to large multi-county health systems. So, for example, Kaiser Permanente, Sutter Health, Dignity Health, University of California, and then the remainder goes to county health departments. And those health departments then can disseminate to other entities. Unfortunately, we don't determine how many vaccines we receive per week. So while the supply is still very low, the state's been determining our allotment, and that's based mostly on population size. And for this initial phase, somewhat on the number of healthcare workers that are registered as working in that county. But we take any of the vaccines we're offered, and we're hoping that that supply will pick up soon.
Do we know how many residents have been vaccinated so far? And as we move forward, how are people going to know when it's their turn and how to go about making an appointment?
Yeah, so the health departments, hospitals, and clinics within San Francisco have administered over 130,000 vaccines to date. And that represents about 100,000 people so far, mostly because a significant proportion of those have gotten their second doses. This is a higher number than the state reported number of San Franciscan residents who've been vaccinated so far, because the majority of people vaccinated to date have been healthcare workers in San Francisco. And more people work here than live here. We have a disproportionate responsibility for vaccine administration relative to our population size. As far as knowing when it's your turn and how to get an appointment, we have set up a website at sf.gov /getnotified, where people can check their prioritization group status. So based on your age and your type of employment, and you can sign up for an email or text message when the your priority tier has been authorized to be vaccinated. The website will also provide links to multiple vaccination sites where you can make an appointment. As we get more and more sites online and as our vaccine availability ramps up, that's the area. So it's sf.gov /getnotified. That's where you can go to see what appointments are available, what groups are vaccinating. Right now, as I mentioned, because supply is so limited, there can be limited vaccine appointments, but keep checking back. And as we get more and more supply, more and more appointments will open up. It is, though, for us and for the system in general, it's an important quality metric to track how equitably vaccine is being distributed to ensure that it's going to neighborhoods and populations that have experienced the highest prevalence of mortality, highest prevalence of disease or mortality to date. In San Francisco, we track these metrics very closely, and our interventions for the COVID-19 response have sought to intervene to try to reduce disparities in healthcare. So we are anticipating that these efforts and systems in place will help us advocate to receive more vaccine quickly from the Blue Cross and from the state once those systems are implemented.
Can you pick which vaccine you get? And do you think we'll be using the Johnson & Johnson version shortly?
Yeah, so currently there's 2 vaccines available. One is made by Pfizer and the other is made by Moderna. And these each require 2 doses each. The Johnson & Johnson one that you mentioned is the newest vaccine to apply for authorization, and it is being evaluated by the FDA. Obviously, we have to wait for the FDA to give it an emergency use authorization before we can give that vaccine. But it has so far, and the data they've reported has been shown to be very effective and only requires 1 dose, which is great. So all of the vaccines are distributed by the federal and state government to local entities, and we don't really get to pick which supply is distributed to us. They make an allocation and we receive whatever they give to us. So in an effort to make sure that we have as many appointments available as possible, we just assign, as you register for an appointment, and then whatever vaccine is available is the one that you would receive. The good news, though, is that all of these vaccines have been shown to have great effectiveness in preventing death from COVID-19, as well as great safety profiles. And just on a personal note, I also work as an emergency physician at San Francisco General, and I just received my 2nd dose of the vaccine and have not had any problems, which is great. I had a little arm soreness and that was it. So I think we're very excited that we've seen such good results with the vaccine so far.
Oh, that's excellent. Well, as we wrap this up, do you have anything else you'd like to share with our residents about vaccines?
Yeah, so my hope is that all of our San Franciscans are learning all that they can about the vaccine and preparing themselves to get vaccinated. I know it can be a scary thing to do something that's new, but there actually is very good data available about the vaccine. And so I'm hoping that people can learn about this. We are trying to help put out information around the vaccine so people can make an informed decision and get vaccinated as soon as vaccines available and their turn comes up. As an emergency physician, I was not in the very first group vaccinated. I think I got my vaccination appointment a couple weeks after they started vaccinating everybody, but I waited for my turn, and as soon as my turn came, I jumped on it. So I'm hoping that others will do the same. I truly think that this is our ticket out of this, and I know this has been a long road, and everybody is tired. San Francisco has done really well throughout the pandemic, thanks in large part to our citizens and people listening to science, wearing masks, social distancing, doing all of the things that science and public health experts have asked them to do. And I think that this is our way out, and I'm just very excited. And I wish everybody had their vaccine yesterday, but we're getting it as soon as we can.
That's great. Very helpful information that I hope has shed some light on our vaccination program.
I think one of the hardest parts has been just how the supply issues that we just wish we had. We wish we had all the doses on the first day and we could just give them out. But I'm hoping that will improve and hopefully, this will be behind us soon.
I hope so too. Well, thank you once again for coming on the show.
Thanks, Chris. It's good to be here with you.
And that's it for this episode. We'll be back with more pandemic-related information shortly. You've been watching Coping with COVID-19. For SFGovTV, I'm Chris Manners. Thanks for watching.